Hello, my name is Candace Bernhardt Johnson, and this is going to be my evaluation for a session, whether it is massage or CST. More than likely, I will end up doing both on her. This is Vegas. She is a 22-year-old. Our best guess is saddlebred quarter horse. She's owned by one of my boarders, and unfortunately, she wasn't able to be here today, but she was kind enough to give me permission to work on her. So a quick history on Vegas. Like I said, she's 22 years old. Originally, or not necessarily originally, but as far as we know, far back owner history, she was Amish owned. We don't really know what she did or how she was treated, but my guess is poorly, based on the way that she behaved when I met her. Excuse me. Then she was used as a barrel horse, and I do know for a fact that she experienced a lot of very harsh training and wasn't treated the kindest. She also developed a lot of bad habits as far as posture. She was ridden in a saddle that was way too small, didn't provide enough room for her shoulders, and so when I met her, we'll say, she had very rounded shoulders. They were very rotated forward. She had quite a hollow behind the scapula and a lot of back pain, among other things. Her brachiocephalic muscle was very, very overdeveloped, while the majority of the rest of her neck was underdeveloped and atrophied. So over the years, her owner and I have worked on trying to correct that. Some of it successful, and most of it, we made a lot of progress up until she was diagnosed with EPM and Lyme. Unfortunately, she had both of them. And she was treated both conventionally and holistically, or I should say allopathically and holistically. And then we went, and we've been doing a lot of physical therapy with her, recently doing massage and CST. So this will be Vegas's second CST session. And so, right. In general, she doesn't have too many alarming issues, though she still deals with back pain from time to time. She has posture problems. She does have a very weak back and weak abdominal muscles. And she tends to deal with a lot of pain in her PSIS. She has a tendency to deal with pain in the lumbar. And in general, sometimes it's difficult for her to really tuck her pelvis underneath of herself and drive forward. So those are the main problems that we deal with. And sometimes, depending on how severe the discomfort is, she will drag her hind toes. I haven't noticed her to drag her toes in a very long time, and especially since she was treated for EPM. And then the other thing we know for sure is that she carries her tail off to the right. My best guess is it was some sort of injury, maybe due to a fall, or it could have had something to do with neurological problems, or it could be the gamut of things. I honestly don't know. What I do know is that she has a tendency to carry off to the right. The other thing that we know for sure is that she had a very difficult time with pressure on her pole. I don't know if that was a poor training problem or if it had anything to do with pain prior to her owner acquiring her. But she has historically had a lot of struggles with her head and her pole specifically, and she has set back and pulled pretty hard into her halter. She doesn't really have a hard time tying. It's more so when she gets upset and she wants to run, her first reaction is to pull, and then she ends up hurting herself. So she has had a recent setback injury to her pole, and that's one of the things that I will for sure be focusing on when it comes to massage and CST, and especially in her CST session today. So that being said, when she was going through EPM, the main thing that tipped us off and tipped her owner off was that she had a lot of facial twitching and ticking. She would blink in an odd way. She would almost have tremors in her face, and then she would have really disunited and bizarre muscle spasms through her back. And then eventually she started to trip. So those were the main things that we noticed. Hey, sweets. So in general, she doesn't really have any obvious asymmetries in her face. She is missing a tooth, and she is due to have her teeth worked on. So that is something that I'm aware of and we're cognizant of. But her bite, for the most part, is pretty good. She's a little bit forward here on the right side, but not too bad. No hooks. Doesn't have any palpable hooks in the molars. Nothing immediately obvious that I would be alarmed by or concerned by. Her right nostril is a tiny bit higher than her left nostril, but that could also be just the way she's holding her face at the moment because I was messing with her mouth. So we'll check on that again here and see if that changes. In general, Vegas doesn't really appreciate her face being handled. She's got a lot of reasons for that. Primarily the pole, but also very, very heavy hands in the past. Not necessarily so much her current owner, but definitely when she was a barrel horse. She has a lot of physical and mental trauma from being a barrel horse. Anywho, so I do not have a hand today as far as doing my gait analysis. So I will do a down and back, side to side, but for the purposes of me being able to see her move, because I can't obviously watch her, I am going to quickly, excuse me, I'm going to quickly circle her so that I can get a better idea of how she's moving today, and then we'll move on. Before I get going too far though, I'm going to do her vitals so I can get a baseline. Her eyes look pretty good. She does have a tendency to deal with seasonal allergies, so she's a little bit puffy. Her lower lid's a little bit puffy. She'll allow me to get a little bit of discharge, but not too bad. Her mucous membranes look good. They're not red. Her gum color is good. I know, it's good. She's actually okay with me touching her today, which is cool. And color comes back immediately, so that's great. Let's see if we can do a pinch test. It's actually kind of hard to grab something. It snapped back nice. And Vegas has a tendency to be very difficult to find a pulse on. So I have my trusty stethoscope to see, just in case if I don't find a pulse on her. Sometimes I can, sometimes I can't. It just sort of depends. She's a really low-key horse most of the time, so sometimes it's difficult to even, it's like, are you even alive? Until she's full of herself. I almost got it. There we are. right, so that feels pretty normal to me. It was about 25, 30, I think. No, I'm sorry, it was more like, here, let me try this again so I can actually see my timer. And now. Okay, so her heart rate's really, really slow at the moment. It's on the lower end, it's about 30. So I'm not surprised, um, being that, like I said, she is kind of a low key horse when she's not doing anything, and she just recently came in to eat, so she's probably not all fired up here. I'll do her respirations real quick. Let's catch a time. Hang on. Yeah. Let's do right about now. Alright, I'm gonna do it this way because she's kind of holding her breath on me. We'll just listen to her lungs. Come here. Vegas, come on. Good girl. Come here. Well, her lungs sound fine, but she's... Oh, okay, so now you're gonna breathe for me. Okay, so I'm gonna call that she's doing okay. I think emotionally she's a little bit concerned about what's going on here, and she really doesn't want to. She's kind of holding her breath. But there's no labored breathing. She's not shallow breathing. She's just kind of holding it for me. All right, we're gonna do a gait analysis real quick. Like I said, I'm gonna go down and back, side to side, and then I'm gonna circle her a little bit so that I can so I can see what she's doing, and then I'll go into palpation and range of motion. Come on, babe. Come on. You turn from? Vegas. Let's go. Come on. Come on. Come on, Vegas. Let's try that again. Trot. Trot. Come on. Run. Come on. Go. Well, I don't think we're gonna get a trot that way. Let's go this way. Come on, babies, let's go. Come on. Come on, let's go. Okay, so it's really uncharacteristic of her to not trot when I ask, even leading. I'm gonna ask that she go here. Okay, so now I can see it. She's very much uncomfortable. She's dragging this right line. Definitely not wanting to go forward. This way. And of course, extremely tight to her back. Come on, very high-headed. That brachiocephalic is very much, very overwhelmed and really not interested. Come on, let's go. Good girl. Very much not interested in going forward. And like I said, she is definitely dragging that mic right. And now we stop. Good girl, easy. Girl. I'm gonna ask, see if she'll walk for me instead of trot. Girl. I'll let you walk. Vegas. Walk, please. Okay, so now we want to trot. Now, I prefer, definitely from a biomechanics perspective, that she not trot if she's going to drag her toes. I'd rather that she walk. Good girl. Now, while her walk is very tight, she is tracking up here on the circle. Good girl. So she's very tight to her back and apprehensive. She's not bent on the circle, to some extent also dragging the left leg. Okay. So I do know that she had some sort of injury to the right stifle area. I'm not sure specifically which muscle it is, just that when she had farrier work done and she was having a very difficult time holding that foot up. All right. Okay. So it could be residual from that. I'll check her TMJ, see if I can get her to move that jaw for me. Doesn't really want to. I don't know if it's just that she's kind of challenging to see if she's got any restrictions. She's holding her jaw so tight. Doesn't seem to have any discomfort here at the TMJ. Nothing specific to note. Nothing specific. Okay. I'm going to check her range of motion of her neck real quick here. A little bit of resistance, but not too bad. Good girl. Like I said, temperament-wise, some of this could be apprehension just from a behavior standpoint. She is a bit tight, though, going that direction, so there might be something going on with her pull. Good girl. There's stuff going on out there. She's a little bit distracted. Okay. What else? Well, since we're already over here, I don't feel anything specifically here in the splenius, although she did like that, so there's a spot there. Rhomboid, serratus. Nothing specific here in brachiocephalic muscle, although she wants to step forward, so there might be something. A little tight here at the back of the shoulder blade. No stress points, just the muscle's a little bit tight. A little discomfort here in the lumbar along the longissimus. Nothing at birth. Now Vegas is ridden, but she has not been ridden in quite a while. Mainly because her owner sometimes has a difficult time finding opportunities. She's very, very uncomfortable back here through the lumbar. Nothing really at the sacrum or the glutes. Although her pelvis is it's rotated forward. I'm not sure if that's because of just how she's standing at the moment or if there's something specific going on there. So this is the stifle slash hamstring group that she was giving her a hard time the other day. There's quite a bit of pressure here palpating, and she's no real reaction. I don't feel anything specific as far as the stress point, although the muscle is a bit tight. Nothing there gasking. Might be a little uncomfortable on that stifle. Just a little bit. The way she's holding her pelvis bugs me. I'm gonna palpate this side of her before I go to range of motion. Las Vegas, can you back up please? Back up for a minute, babe. Good girl. Well, like I said before, she's very underdeveloped here in the serratus, bit of the rhomboid and the thoracic trapezius. It's all pretty atrophied, and I know that's because of the way she carries herself. She's very tight and upright. She has a tendency to drag herself along, and a lot of that's from the EPM. Some of it's from poor posture, from the way she was ridden in the past. So unfortunately, it's become very much a habit for her. I don't feel anything in the shoulder. Hi. Am I poking on you? Am I poking on you? Now I'm taking my time with her because she has a tendency to be very bothered by quick and abrupt movement, and I don't want to upset her prior to CST. It's not as reactive here on the left side of that longissimus and then lumbar. Like I don't feel any stress points, sorry, her hair is everywhere. I don't feel any specific stress points, but she does seem very uncomfortable through there. Although this biceps femoris is definitely a lot looser than it is on the right side. So she had to have done something, not quite sure what that would have been. Again, no stress points or anything. Down to semitendinosis, semimembranosis, there's nothing to note. She is holding her tail pretty straight compared to what she usually does. She's resting that right hind there. Okay, so I'm gonna go ahead and do range of motion through her legs, get that out of the way, and then we'll go into the CST session. Excuse me. Hi, sweetie. All right. See your leg? That's a good girl. All right. So the knee, there's really no restriction at her knee. video. Although her fetlock is quite tight, not a whole lot of range of motion in that fetlock, but her knee is very nice. No real restriction in the shoulder. She can extend out pretty well, it looks like. Good girl. Try this one. Good there. So again, no restrictions here at the knee. Although this fetlock is extremely tight. Very, very little movement side to side. Quite a bit of resistance, inflection. Not really a fan of outward movement of that shoulder. But she's got plenty of range of motion forward. Resting that right hind again. I will ask gently, I know. Now see if she'll put her weight on that foot for me. There's that. Not really a fan of picking it up, but picked it up fine. Very tight, resistant to extension. I would imagine it's because she wants to balance on it. She really doesn't want to hold it up for me. Fetlock and pop are good. See if I can get her to, oh, hips good. Stifle looks good. Not really a fan of reaching it forward, which understandable. Bring her forward, around. Come on there. Come on, girl. See if we can get this one. All right. She's got a little bit of edema here at the fetlock, which is kind of odd because no problem holding that one up, huh? Yeah, no problem holding it up, but it is uncomfortable. Okay. So I would like her to extend it for me. She's not really interested in extending it back. Very, very, very hesitant and apprehensive to do that. Oh. A little bit of heat here at her cornet band. A little bit of heat on the hock, on the inside of the hock. Girl. But she is more than willing to reach that forward. But very uncomfortable, it would seem. Very, very uncomfortable through here, that would seem. And now that she's holding it up, it's quite tight around that stifle joint. It's quite tight. Quite tight, huh? All right. Now, I'm going to see if I can get her to stand for me. See if I can get her to square up the best that she can. So I can check her shoulders and her haunches, pelvis. Come on. You're good, Mare. Can you step back for me? Step back. She very much wants to rest that right hind. on where we're standing right here, that her right shoulder. Her right shoulder is quite a bit bigger than the left shoulder, by a lot actually. Very big compared to her left side. She's got a very, very large right shoulder compared to her left shoulder. She's actually sort of curved towards left. And I'm not sure if I'm going to be able to get her to stand up with her pelvis. Not quite sure if we're going to get that. Come on. Stand. I need this foot forward. Girl. It might be as good as it gets. So her pelvis is actually level, although she seems to have more muscle development on the right side of the pelvis than the left side of the pelvis. Now that she's standing a bit more square, she still has a very large right shoulder versus her left shoulder. Quite a bit more muscle development on the right side than the left side. But the pelvis, the SSI seems very level. As I said though, the right hip seems to be much more developed than the left. Okay, so we'll go ahead and get back. Get back. Back up. Back up. Good girl. All right. I'm gonna pause this real quick. I'm sorry.